Hey, good morning. My name is Hans-Erik Aronson. I'm the director of DARE UK Phase 1. So this is the Data and Analytics Research Environments UK. And just a couple of housekeeping rules. Please remain muted at all times unless invited to ask a question during the Q&A session. To ask a question in the Q&A session, please put your question in the chat box before and during the Q&A section. Or you can also use the raise hand function if you wish to ask a question out loud. Please keep your video off during presentations. You're encouraged to turn your video on during the Q&A/discussion session, of course. And the webinar is being recorded. And I should also mention that this is this whole webinar is devoted to the sprints more than the core DARE UK program. So I suggest that you direct your questions to the sprints more than to the central program. So DARE UK, the program vision is to enable a step change in the UKRI/National Research Capability for secure sharing, linkage analysis of sensitive data for research and innovation, and to do so at pace and scale. It's a pan-UKRI initiative, spanning the 7 councils, and Innovate UK Research England is in principle not on the UKRI Digital Research Infrastructure Committee that we fit into, but in essence, we are a pan-UKRI initiative. This is a multi-phase, multi-year program. We're right now in the design and dialogue phase, phase 1, which started in July of 2021 and ends at the end of August of 2022 this year. And at which time the phase 2 will commence, which is the build, test, and establish phase, where we are testing out the design principles that are being advanced in phase 1. And phase 3 follows on that, and that is when we bring it to a larger scale. So in phase 1, the design dialogue phase, what are we trying to answer? How should national secure and interoperable digital research infrastructure and associated services be designed and implemented? For the larger program, of course, to connect and analyze complex, sensitive data from cross disciplines and sectors in flexible, efficient, and sustainable fashion. This is a program that is sponsored by UKRI, and of course, we was jointly commissioned to help Data Research UK and Administrative Data Research UK to jointly run phase 1 of this program. We have a series of assumptions that we are working under. We're not starting from scratch. There's significant knowledge in this space across the councils. There's a cross-council need. A federated infrastructure is technically feasible. It is ethically and legally feasible and would be trusted by the public. This is a core part of this, that the public finds this a trustworthy enterprise and mission. It is feasible to accomplish in the funding and time envelope set by UKRI, and that there is strong buy-in from the research councils, the government, the data custodians, and the researchers for this larger approach. We're of course seeking impact to do science at scale in a sustainable and secure fashion. We did a landscape review at the beginning of this journey in the fall, together with Colonel Ferrara data consultancy. And six themes emerged from that landscape review that were of concern to the researchers and the technologists in the field. Data and discovery were perhaps foremost, that finding data and having access to data. The access and accreditation is absolutely key, both for researchers to gain access and how to accredit researchers, and as well as TREs. The infrastructure itself, the compute and network infrastructure and data storage infrastructure is something that also needs to be addressed to have the right infrastructure in place. Capability and capacity really speaks to having sufficient people and training to run this enterprise going forward. Demonstrating trustworthiness again with the public. And lastly, funding and incentives, basically how to make this, to make the business case for this federated landscape that we're trying to create. So in phase 1, we have a process for this. which are presented in this diagram here. You can see the 6 areas of concern that was raised in the landscape review. Are the key processes that we are working under are the Sprint exemplars that will be presented today, public and stakeholder engagements, and our deliverables are the blueprint for how this federated landscape should look going forward, as well as the business case that will inform the Digital Research Infrastructure Committee of UKRI for how to fund this appropriately going forward. We are called upon to provide a detailed delivery plan for phase 2 and an outline delivery plan for phase 3. Again, this is a multi-year project, and it addresses the needs of the researchers, data custodians, and the TRE community, and very importantly, the public. We have a small delivery team that you can see in this diagram here. I head up the phase 1 of the program. Jerry Riley, who will be speaking next, is a design authority, and he is working with Sushil Varma, our technical lead. And we have 2 program managers, Fergus McDonald and Michelle Amubi. We have a communications and engagement manager, Lizzie Wayne, and we have a business partner on the finance side. We all sit in HDR UK, but again, we are jointly managed by HDR UK and ADR UK. There's our link to our website as well as to the landscape review. And at this point, I'm going to hand over to Jerry to discuss TREs.
Okay, thank you, Hans-Erik. So good afternoon, everybody. I'm Jerry Riley. I'm the design authority for this first phase of the DARE UK programme. So the sprints you're going to hear from today are a key element of the design activity for the first phase of the DARE UK programme. As you will hear, they will test out a wide range of potential approaches to creating a more integrated approach to digital research infrastructure, exploring approaches to advancing risk management and governance, but also importantly, exploring what are the tractable use cases for the use of such a research infrastructure across council research. Very importantly, what we're looking at is the use of sensitive data that spans the UKRI councils. All of this will be conducted with a very keen eye as we go through it, with public involvement and engagement. That is central to any research on sensitive data. The purpose of the sprints are really to help inform the blueprint. You heard from Hans-Erik a moment ago talking about the flow from phase 1 into phase 2. This is about informing the design of the blueprint for phase 2 and phase 3 of the DARE UK programme. It is about learning from the successes, and probably in some cases from the not so successful elements of the sprint. It is about the open contributions from the community we will build around the sprint, and the discussion that will occur within the sprints, between the sprints, and between the sprints and the wider community, so that we can inform a really great design for phase 2 of the programme. We have already started to draft a few elements of that design, of that blueprint, but these will be continuously refined over the next 8 months or so with these new learnings. And the Sprint community is a community of key critical friends that will continue to challenge us and to improve the DARE UK programme as we move into phase 1 and 2. This is a really exciting group of sprints. I've certainly been really excited to see what was selected. So I hope you'll be all as excited as I am to hear what they say. However, before we step into those sprints, and particularly given that a number of the sprints are around infrastructure for trusted research environments, or federation of trusted research environments, or the governance around trusted research environments, I just wanted to take 2 minutes to talk about trusted research environments, because whilst I look at those attending today, and I know many of you understand what a TRE is, not everybody does, and not everybody has the same common understanding. So the intent around trusted research environments is around providing a safe environment for the research on potentially sensitive data. And that to now is really concentrated on data that is personal data, so administrative data, educational data, health data, but it's to do that in a trusted and secure environment where the risks of re-identification of that data, the risks of misuse of that data can be appropriately controlled. So as you'll see on the slide, this really comes down to, it's not around a particular architecture. There isn't a standard implementation of a trusted research environment, but there are some things that are really critical to the concept. So these are around, and you will hear about bits of these from a number of the sprints. So these are around safe people, making sure that the people who can access these environments are people who are accredited, they're researchers conducting appropriate research for the public benefit. They're projects that are appropriate for the research. They're not about providing access for journalism. They're not about providing access for insurance. They're about providing research that will inform future developments, future research from academia, potentially industrial partners, but within the scope of appropriate controls on those projects. It's about a safe setting. And this is about having secure environments that are accredited, that have a strong approach to cybersecurity, so that the risks of penetration by people who shouldn't have access are controlled. So it's about having secure technology services, and that the data within those is held safely within those environments. It is only accessed by those people who have access to those environments and can be secured under appropriate privacy policies and used with latest technologies around privacy enhancing technologies and de-identified appropriately. And importantly, the final path through this is safe outputs. What comes out of these environments is not the data. What comes out of these environments is research outputs. It may be tables, it may be graphs, it's what will inform the research papers that will get published. And these are checked to make sure that there is no leakage of raw, potentially re-identifiable data out to the outside world. So there is a rigorous set of safeguards, and that's the concept in many ways of the TREs isn't so much around the technology architecture as around the characteristics that define a TRE. So you'll hear a lot more about this in the coming projects, in the coming discussions in the next few minutes, but I felt it was just worth talking a little bit about what we conceive as TREs, because TREs are really at the heart of what we're doing with the DARE UK programme. It's about taking some great work that's already going on and making sure that can be more effective, more interoperable, more useful across the pan-UKRI Council world. So with that, I'd like to now just hand over, because I'm sure you want to hear from the project, so I'll hand over to Fergus to start hearing from each of our projects.
Yep, fantastic. Thanks, Jerry. So I think we'll get straight into it. It might be worth just to start with, we're sort of, again, it's a time constraint thing. So we're going to sort of do the projects in batches. So we're going to have, I believe it's 4 projects to start with. So they're all going to present more or less one after each other. And then we'll have more or less a 15-minute Q&A followed by the next 5 projects, and then a 15-minute Q&A again before closing the call. So it might be worth any questions that you might have, you know, for the first project, just take a note of it, drop it in the chat, whatever you're comfortable with, and just make sure you sort of have who the question is relevant for in terms of the project itself. All right, jumping straight into it then. So for our first sprint project, we have Dr. Christian Cole from the University of Dundee.
Hello, thank you. Let me just share my screen. No. All right, so can you see that okay?
We can, yes.
Okay, great. So hi, yeah, so my name is Dr. Christian Cole. I'm a senior lecturer at the University of Dundee, and I'm here to talk to you about our Treehouse project, just to bring in a little bit of Scotland into the UK there in sprints. So I'm based at the Health Informatics Centre, otherwise known as HIC, and we're embedded within the School of Medicine at the University of Dundee and on the east coast of Scotland, as you can see there. And we established a TRE, or Trusted Research Environment, and have had for over 10 years, and we've supported thousands of research projects over that time, which include access to NHS Tayside data, as well as more widely across Scotland as well. And we are a large team now, currently about 60 people, and we work on all aspects of data within the safe haven, it's sometimes called as well, in data linkage, governance, software development, and the computing infrastructure, which are all really critical. And we're also moving to do more research activities in machine learning and data science on the data that is prepared. Now, Jerry's done a really great introduction to TRE, so so I'll give my little spin on it, and just to say that we've had this on-premises TRE, so it's something that we've managed locally within the University of Dundee and managed by our infrastructure team together with the university team. And as Jerry says, it's all about the 5 safes. And the environment is enclosed. Nothing can go in and out without permission or without access. And traditionally, the TREs have the data within their environment, and certain software tools are made available, and it's usually within a Windows environment, so it's familiar for the researchers to use. And oops, what's happening there? Oh God, that's gone a bit horrible. Apologies for that. Right, sensitive data is anonymized and ingressed into the environment, and only the data that's required for the research is made available to the researcher, and researchers have to be approved. They have a login requirements, and they only have a single way of getting access to the data, and they can do their work within there. And like Jerry says, only aggregated and summary data can be output for publishing in papers and things like that. And so that's how it currently works, or is the traditional way for a trusted research environment to work. Now, there are some issues with that, because there are very many TREs around the country, and they're all different. So we've had a lot of duplicated effort. The opportunities to share the learning hasn't happened really quite as much as it should do, and they're expensive to run. So we need to try and find some efficiency gains here. And importantly, the needs of researchers are changing all the time, and TREs aren't able to adapt and able to support quickly enough to support really large data sets of petabytes or hundreds of gigabytes of data, artificial intelligence type methodologies, and large DNA sequencing projects. Industrial partners don't want to share their algorithms as readily because of intellectual property issues with TREs, although, you know, collaborating is really a powerful thing to do. So we at HIC have built a next generation TRE, which has tried to solve as many of these problems as possible with a cloud partner, and it allows access to much larger tool set and much more scalable computing infrastructure. So you can go from a single CPU to thousands of CPUs if you want, if you've got a really complex data set. And all the 5 safes are still there. The sensitive data is anonymized or pseudonymized. Algorithms can be in a secure enclave, and that's one of our project aims. Users are approved and locked down, and there's no access to any internet or any email. There's no way of releasing data other than through a controlled mechanism via our team. So the impact of our project is to share our knowledge that we've gained over the last 2 years working on this next generation TRE, and as far as we know, this will be the first freely available open source TRE solution that will be shareable. We aim to reduce the cost, time, and expertise required to deploy a TRE, which then, with this common infrastructure, will allow federated analysis across TREs across the UK, which currently is really difficult, and will support the needs of researchers and industrial partners. So as Jerry says, and others have said, the public engagement is critical. So we're building in 2 workshops to gauge and inform public opinion and to feed back into our project. And we'll be producing a knowledge pack and information on how to present TRE work better in public environments. And so from that, I'd like to thank the funders for funding our work, and I look forward to talk to you again in future with our successes. And thank you for listening. And I'll take questions at the end. Thank you.
Fantastic. Thank you very much, Christian. So moving smoothly then on to the next one, we have Professor Michael Boniface from the University of Southampton. At least I hope we have.
Yeah, we do.
All right, thanks, Michael.
Okay. Right. I think you can all see my slides now. So yeah, good morning, everybody. My name is Michael Boniface. I'm the director of the University of Southampton IT Innovation Centre, and present to you to the project Pream, which is about privacy risk assessment methodologies. This is a partnership between University of Southampton, University of Warwick, and Privatar Limited. So our motivation, as is the programme itself, is that to improve health and well-being and efficiency of our systems, and to support the research associated with that, we need to increasingly combine diverse data sets which are maintained and managed by multiple organisations. And increasingly we're seeing the bringing together of conventional data that comes from medical records and social care with new forms of data such as wearables and research-specific data sets. But to do that, there are risks, and those involved in the research and governance guardians of data sharing must be provided with the tools to manage those risks. And even though we have many of the principles which you've heard in previous presentations, the privacy management is still quite a vague concept, especially when considering the different perspectives of those involved in privacy assessment and management. So there is guidance, but it's not consistent, and this has resulted in different implementations of trusted research environments across the country. And so a common way of assessing privacy risk is needed, and that is what our project is about. So we're looking to publish best practice for privacy risk assessment, specifically targeting safe data usage in research networks and addressing the concept of federation between different organisations and federation of linked data between different organisations. We'll build on the principles of the 5 safes. These are important and have been effective over recent years, ensuring that we have the right sort of people, projects and environments. And we'll combine that with methodology for risk assessment, specifically security risk assessment, and the standards such as ISO 27005. So we'll take the principles, we'll apply standardized methodology, and we'll also look at emerging tools that will help people in making assessment of risks in what can be quite complex systems. It includes computers, people, data, processes, and to see that we can come up with ways of measuring risk in relation to the perceptions of impact of the data subjects, the guardians, and the senior risk owners involved and responsible for the protection and safety of the data. We'll do this by analysing use cases. We have a number of use cases from public health prevention and integrated care, and more emerging as we discuss things with our stakeholders. But the primary use cases, look at things, and if you look at the bottom right-hand side of this diagram, we're seeing the emergence of, for example, trusted research environments coming from routine care within the NHS, the emergence of integrated care systems and data lakes. And we need to understand how to bring them together with other types of research assets within the projects that our researchers need. We'll be looking at those use cases, trying to identify risk factors, and then produce a framework to help different types of people think about those risks. We'll then look at implementing that in risk modeling tools, so we can simulate and come up with some measurements of trustworthiness. And we'll do this in collaboration with the public and other stakeholders across different disciplines. Key part of this is to get involved in our work. So the framework is being co-designed with the public and stakeholders from different disciplines. We will have an involvement network of a focus group of around 15 people, and then we'll be doing a wider survey. We also have an advisory board which we have representatives from both policy, legal and practitioners. The whole process is led by experts in that discipline. And there's a couple of names here which I'd like you to note. James McMahon, who's leading our public involvement, and Dr. Suzanne Weller, who's leading our advisory board. If you'd like to get involved in that directly, you can proactively contact us. Of course, we'll be contacting you too. But yeah, if you really want to get involved, please contact those people directly. Our expected impacts are as follows. We expect to improve the understanding of privacy for different types of stakeholders and how they can use that understanding to assess risk. Expecting to work towards best practice for consistent, efficient application of risk assessment. And we're hoping that organisations will be better informed about the decisions that they make. That will be a key goal, that the assurances that organisations make are based on informed decisions. And the consequence of that, we're hoping to accelerate safe data usage so we can address things like the NHS priorities and the wellbeing requirements of our country, and also reduction in research costs, of course, through the automation, semi-automation of privacy risk assessment. So thank you for listening. That's our project.
Great, thank you very much, Michael. So then we'll jump to the next project, which is Professor Elizabeth Sakey from the University of Birmingham.
Thank you. I hope you can see my slides in view there. I can see a nod, wonderful. Well, look, thank you so much for inviting us to be part of the Sprint family and also to present what we're doing today within this project, which is called Fednet. So I think it's recognised across the whole programme that the big societal issues that we're all facing requires data and partnerships which span sectors and disciplines. And whilst that's really a noble aim that we have to make work, there are major challenges to make this happen. The first is public understanding, trust and support in using data, particularly sensitive health data. Then there is the challenge of ensuring data can be combined when it's collected for different reasons and from different computer systems. And getting that balance right between data security and data access that's needed in order to form solutions to the challenges we face. And so Fednet is going to look at these challenges with a case study of a Midlands-wide effort to improve asthma outcomes for our patients. What we want to do is reduce the impact of health inequalities by understanding how poverty and pollution can alter asthma control. And that's the case study that our project hinges on. But by delivering this, we will also be able to combine data from different systems, including pollution, poverty, and health data. We can work towards federated analytics, which is where we can build models where the data can stay put with its data controller and the analysis can move. We can build open and trusted data alliances between the NHS and academic partners and expand a tested governance model that's already in place. And crucially, build public trust by transparency and involvement. The data that we're going to bring together crosses 6 sources: 2 electronic health records from hospitals that both use different systems, translational data that tends to be laboratory endpoints from 2 biomedical research centres, and then pollution data and meteorological data, weather data from 2 sources. To bring these data together, we're going to combine them into a common data model so that they can be combined and used in analysis. We're fortunate to have 2 trusted research environments already operational, one in Nottingham and one in Birmingham. And the one in Birmingham has already serviced over 50 projects, so there's significant learning available. But we're going to link them in a federated system for analysis. And the learning will be open source and freely available so that we can support other people to adopt similar TREs or cross-links between different TREs based on what we learn. Governance is really important here. It's about making sure that data is used for appropriate purposes by people that we trust in accordance to the 5 safes, which others have spoken about so eloquently. The model that we're using has been operational for 18 months. It has HRA and CAG approvals for data access. We're proud that patient and public involvement is present in every single project that we support, and the current one is no different. And there's also patient and public oversight in all of our data sharing decisions, which I can talk to later if that's of interest, but that's with our innovative data trust committee. As part of Fednet, we have a professional patient and public involvement and engagement lead, and we've already developed a patient and public advisory group. They're going to help us develop and deliver 2 workshops and a webinar, supporting conversations about the benefits and challenges of federated analytics and what this might mean for less digitally mature health systems, so we make sure that no one gets left behind. And we're going to test if our patient and public involvement and engagement has actually worked by assessing whether it's increased understanding and trust. Our outputs will also be inclusive, including transcripts, large prints, and commonly written languages, with both Birmingham and Nottingham serving multi-ethnic communities that we want to make sure everyone understands what we're doing and benefits from. And these activities will have match funding from our BRC, the Pioneer HDR UK hub, and also from commercial partners such as Microsoft that are helping us build links across our trusted research environments. So what do we hope to achieve? Well, we will have a template for federated TRE networks that will be freely available for people to use. We'll have a map of the limitations and benefits of common data languages when you're combining diverse data sources based on our test case of asthma. The test case of asthma will produce a deeply phenotyped cross-council data asset. That's something that really hasn't been available before, that we'll be using and making available on our HDR UK gateway. An expanded information governance framework, bringing data controllers together so that they feel comfortable in sharing data using our system. Improved public understanding of our system, and I hope a framework which we can go on and build with other regional, national, and then international initiatives. Thank you.
Thank you very much, Elizabeth. All right, then our final project for this block before we move into the Q&As for these 4 projects is Nicholas Mills from the British Heart Foundation. I do see a screen. We don't hear anything yet.
Apologies. My name is Kathy Harris and I'm presenting on behalf of Nick, who is has clinical duties today, so is unable to present, but has actually joined us, so we'll be able to support on any questions you might have. But in the meantime, I will just talk through the project on Nick's behalf. And thank you very much for the opportunity to discuss this project. My name is Kathy Harrison. I'm the program lead for a project called Datalock, which is a data service that is part of the data-driven innovation program within the University of Edinburgh. And this project will be led by the University of Edinburgh team in collaboration with Public Health Scotland. Professor Nick Mills is a consultant cardiologist and the health and social care lead for the DDI programme, and as I said, is on the call with us. I'm also joined by Michelle Evans, who leads the DDI talent programme, and the project is supported by EPCC, who are the technical team within the university who provide the technical infrastructure for the TRE. In terms of this, what this project is focusing on, it's already been acknowledged that TREs have been historically designed to support traditional academic and clinical research, with researchers using standard statistical analytical tools. This is the user group in this diagram on the slide that's in red. This project is looking to extend our understanding of the expectations from non-traditional researchers and innovators from different disciplines, those in green on this graphic. It's widely recognised, indeed we've already spoken on this call, about the impact that non-traditional researchers and innovators, including software developers, AI experts and others from third and private sector organisations, the role that they can play in driving improvements into healthcare systems. But we also know that access of TREs by these users has been limited. It remains largely aspirational, so we're not seeing huge engagement from these users, and hence aren't pulling through those benefits in terms of the improvement to healthcare systems. You can see from the comments on the right-hand side that users are really struggling to engage with research on TREs if they don't fit within the current model, or they simply are unaware of how TREs work and unaware of the expectations on them as safe users. Often their work requires active collaboration between clinicians and across disciplines, or with coders that haven't historically been part of the 5 Safes framework for TREs. That's the problem that we're looking to tackle. The team is going to explore those barriers to the use of TREs by these users and will design a governance structure that's based on the 5 Safes model to support TRE access for users in Scotland. We'll add to this a user training module that will be designed to equip non-traditional users with the skills and understanding and credibility to access healthcare data in TREs. The project will investigate public perspectives around these users accessing health and social care data, particularly asking what is expected from non-traditional TRE users to be considered trustworthy and credible, and what public concerns exist around their use of TREs today. In terms of the governance framework, the design that we will have as an output for this project will extend the current 5 Safes definition, considering things like understanding changes needed to ethics frameworks, what flexibility is needed from users to develop software tools in this environment, a view of how you can manage risk within this context, what safe coding outputs look like, de-identification, pseudonymization standards. There's a number of questions that we need answering within the governance framework. And our output will include a framework and a supporting workflow that sits beneath that framework. The second element of the project is looking at a training module designed specifically for those non-traditional users. The course will show users what their responsibility is as a trusted researcher. It will introduce them to the TRE safe settings and data security controls, but we're also looking to create a bite-sized data awareness course that will be available for the general public, for other data professionals, to support increased awareness of the sensitivity of healthcare data security and the benefits of data usage within the TRE setting. And the final deliverable from the project will be the output from our public involvement. So we're looking to build into our governance design safeguards that we'll identify through our public involvement work, as well as clarifying for non-traditional users what the public expectations are on them to deliver public value and transparency in their projects. So the public engagement sits beneath the design of both the governance framework and the training course for non-traditional users as well. And that's the project. Thank you.
Fantastic. Thank you very much, Kathy. So more or less opening the floor. If anyone would like to ask questions in the chat, or by all, please just raise your hand and feel free to ask them directly through the call. So I see here from Melissa in the chat, great overview. Sounds like sharing insights is a common and important theme across all projects, which is great to see. What will the approach be to sharing those insights, and when? Example, during, after, or both?
You need to take that from a program.
Yeah.
So this is Jerry. I'll take it from a program point of view, and then invite any of the projects to comment, including those who haven't spoken yet. So absolutely, Melissa, it is about open sharing, because we're looking for the sprints to inform our own design, but we've also built into the whole process around the sprints a model that will openly share the outputs, very much through mid-sprint review. So there will be an open mid-sprint review that will be attendable by anybody who wants to hear what's going on. There will be an end of sprint review, but also the outputs from the sprints will be openly shared. So we're not looking for this to be closed assets or closed publications. So we expect to create, hopefully through the sprints, a lot of shared insights across a lot of areas. So yes, it will inform the blueprint, absolutely, but I expect that the learnings here to be way wider than that, and the obligation will be around open publication and open sourcing all of the assets that come from the sprints, which is another key principle of how the sprint program has been designed.
Thanks, Jerry. I'm not sure if any of the projects want to jump in there.
I'm happy to jump in. Hi, Liz, if you want me to. Just to really echo that and say that when I was talking about this being part of a family or a community, I really meant that. All of the sprints have shown a huge willingness to learn from each other and then share that learning. And I think it's going to be an iterative and ongoing journey, because when we come up with a potential solution, it's going to be really important that the wider community scrutinizes that and helps identify the aspects of that which worked and where it could be improved. So it's a journey I hope we're all going to go on together.
Thanks, Liz. All right, just looking in the chat as well. Melissa, great. Okay, so we've answered Melissa's question. Any other questions here? Jan Davies says, I'm encouraged with the use of PPI involvement in the projects. Most important. Yes, we agree completely. Further questions? Clarifications?
I'll say writing in the chat. What are the views on trying to enable cross-disciplinary research when maybe data is existing in different TREs? I'm also thinking about things like the sort of newer AI applications that people might want to create, because they often benefit from having very large sets of data put into them, but then that's not always possible.
Maybe Vasilis, I'm not sure if I hope I'm saying your name right, or Vasily. Is that to someone specifically? I see Chris has his hand up. Is it more general?
Yeah, let's go with Chris, because he spoke about TRE first, so that would be good.
I mean, I can just talk about the ideas that we have in principle. So there are active research areas in looking at federated analytics and federated artificial intelligence or machine learning, so that we don't spend lots of time shunting data around different TREs, because that's tends to be the current model, is that you have to go through a whole governance protocol for weeks and months to allow access to data, and then the data is it's either stays in place and you move the algorithms there or whatever. But the idea and one of the points of our project is to have a common infrastructure available to anyone to use, so that you can spin up your TRE, which is common to the one that we use, for example. So then the commonality of infrastructure allows you to quickly get up to speed to be able to run an algorithm across the 2 different sites, or 3 or 4, whatever, in a consistent manner, and then be able for them to talk to each other, obviously all securely managed and tracked like that. So I think from our point of view, part of the process is to get a common set of infrastructure so that we enable the access more readily and more quickly.
Thanks very much, Christian. I'm going to go with Susie. I know there's a question in the chat as well, but let's start with Susie.
Rookie error of trying to get unmuted and unvideoed. Apologies. So I'm with Professor Sapie on the Fednet program, the technical director, really. So just to come to answer that from Fednet's perspective, Vasilis, I think pretty much as already said, but I think the key bit for us is we're starting with synthetic data and trying to make that representative. But I mean, I think what we do know about federated analytics is they work very well at the sort of low end and at the high end and somewhere in the middle. So federated learning, we know, I can see from your smile, so federated learning is kind of good. So we're trying to sort of assess the outputs that we get based on a single data set in one place versus the federated outputs that when we're passing that code through, so we can actually provide some sort of reassurance and comparator. But the ultimate aim is to have a system whereby we can pass that code and it can be at the federated learning end as well, where then you can sort of trust the results. We're going to have the sort of metadata catalog and make that very sort of open and transparent. And in terms of any technical sharing, again, it would be interesting in the chat to see the sort of places people want, but it'll be obvious things like Git and Slack. But yeah, hopefully that gives you some reassurance where we're going on that.
Thanks, Susie. Michael, same question?
Yeah, same question.
Oh, then go for it.
So Vasilis, I think what we need to think about, in my opinion, is the patterns of federation. Is seeing data distribution patterns, because federated learning is one pattern, and there are times when you need to move data or don't move it. And so for a federation, we're looking at how you create essentially data supply chains and how you govern those and the rules and responsibilities for moving data when it needs to be moved and when it's not. And there are a distinct set of patterns that can exist, which include federated learning, but there's things like resource sharing, resource encapsulation, and these are the primitives that we should then be using to govern the federation of the data.
Great. Vasily,
Sorry, go on.
I just want to make sure that that's more or less covered. I just want to make sure we also have time to get to, there's another question in the chat. So are you happy with that?
Yeah, no, I think so. It's a complex area, and there's homomorphic encryption and things like that as well. But that's complex as well. So yeah, there's different ways of approaching it.
Fantastic. Thanks for the question. So then, looking in the chat, we have a question from J. Patrick Woolley. I have not heard anything on data without consent. Can someone share thoughts and approaches to trust? I guess Liz already has fired her hand up, so I'm happy to then pass it to Liz.
Thank you. I'll start it off then to hand over to colleagues. So, we are using unconsented health data for some of the work that's done, consented for others, depending on what the model and the question is. For unconsented health data, there is, of course, the national data opt-out, and we're doing huge campaigns to increase awareness of that, so people have the ability to make a choice, including in different languages. So we've now run campaigns in a local of languages which are locally spoken and read in Birmingham in both written and recorded form. But in terms of then thinking about how you use the data in the most trustworthy and transparent way, well, the first thing to say is that we wouldn't support any projects where patient benefit isn't heart and central to what we're doing. So there has to be a direct link to improving health care and well-being for our population and patients. And every data request that comes through is reviewed by our Data Trust Committee. This is a group of lay individuals coming together, incredibly diverse, frequently refreshed as we grow and expand and change, that review every single data request, and they make a decision as to whether or not the potential risks of data sharing are outweighed by the potential benefits of the project. And 80% of them have to agree that the project is worthwhile for us to go ahead and support it. And all of the outcomes from the Data Trust Committee are freely available on the Pioneer website. So do have a look. But that's the model that we've been utilising in order to make sure that patient and public voices and thoughts are really at the centre of the decisions that we make.
Thank you very much, Liz. Michael, I saw you had your hand up, but you seem to have put it down.
Yeah, Liz has said it really. I think that from our point of view, there is a challenges in engaging lay people in the decisions around stewardship, the language of privacy. So Pream is very interested in how you essentially you engage the different stakeholders in that decision process. And this is one example of how you do that, but there may be some others.
Great, thanks, Michael. I think it's also worth mentioning maybe on a program level as well. We've had just recently, I think 3 weeks ago, it is now, losing the time a bit, we've had public engagement workshops, from a sort of the overall program perspective. And we also, a very big part of the recommendations that we'll put forward, we sort of have a whole theme around demonstrating trust and sort of how to do that. And what works there. And we have in March, further workshops to basically elaborate this out and discuss with the community and the public how best to do that. So there's really a lot of work also on a program level into the public engagement and involvement aspect of the work we're doing.
A really
Fantastic.
A really interesting observation is the perception of risk is quite different depending on who you talk to. Data owners, subjects, guardians, and the like may see the impact of a particular risk factor differently, and how you bring them and combine them together so you get an overall view of the risk that you're taking is an essential part of the decision-making process.
Great. I did see a question come in from Sam here. Maybe let's pick that up potentially. If it's for a specific project, Sam, perhaps you could just indicate it's for Christian. All right, then maybe we can take that up. Just because of time, let's move on to the next presentations, but perhaps in the next Q&A, we'll do it with the other projects, and at some additional time we can address this as well if Christian's still with us. So let's then move to our next presentation, which is Dr. Rob French from Cardiff University and Charlotte Austin from Diabetes UK.
Great. Have you got that those slides?
Yep.
Okay. Great. So my name is Rob French. I'm a statistician at Cardiff University, working on education and health data. So I started working on people's health records and education records in about 2014. I've been working on them without much public engagement at first, but as we started to do more complex things with the data, linking health records to education records and so on, it became more important to get some approval and understanding from the patients and the people whose data we were using. And that work has developed, and a few years ago we started to work with Diabetes UK, and that collaboration has really supercharged our patient engagement, and that's sort of led us towards the project and the engagement we're going to talk about today. Okay, so I'm just going to talk a little bit about the research first. So our work is looking at young people with diabetes and their education, and we're thinking about two aspects to this work. So firstly, how does a child's health affect their education? So how does a diagnosis of diabetes affect their exam achievement, or it could be their school attendance or progression to university or whatever. And then equally, the education can affect your health outcomes. So the example here is, perhaps in 10 schools we have diabetes training for teachers, and then how does that affect the blood glucose levels of the students that attend those schools compared with schools without the intervention? So we're thinking about these effects going in both directions. Okay, now of course we're not just thinking about diabetes or health and education. There's other things like your ethnicity, your socioeconomic status, and things that affect both your health and education and affect this relationship. So we have to think about those types of data and information as well in the work we're doing. And then of course the groupings as well. So what's the importance of schools or clinics versus the effects on individuals, because we need to know how to target interventions. Should they be targeted at individuals, or should we think about schools or clinics and so on? And equally, there's lots of children's health conditions, and diabetes is just one of them, and many of these other conditions have more dramatic effects on the student attainment and the students' experience at school. But I think we justify focusing on diabetes because then we can get a lot through with one single health condition, and where we've got good patient support rather than doing something broad, and then we can perhaps disseminate that information to other health conditions. And diabetes is a leader across young people's health conditions for a number of reasons. It's also a leader in data as well, because the data collected is a bit more mature and perhaps a bit cleaner than from other health conditions. So I think we've got a strong case for the importance of this research, and also why it's important to support other health conditions as well. Okay, so in terms of the data we're collecting, we talked a little bit in a couple of other presentations about the multidisciplinary data. So we're thinking about education data and health data here. So this informatic just shows age across the top, with some life events mainly related to education. And then here we've got the Diabetes UK infographic for the diagnosis of diabetes. So we're thinking about the 4 T's, the toilet, thirsty, tired and thinner. So those are the 4 things to look out for when someone's going to the toilet more frequently, or drinking a lot, more tired than usual, and losing weight. Then if those 4 T's occur, that's often a trigger. So just to remind everyone of that. But so a person might be diagnosed here, and then the effect on their education going forward is the effect of the study. But likewise, it might be that what's happening in schools is then affecting their diabetes management. So the data we're thinking about, schools data, college data, which is stored slightly separately and coded differently, higher education data, graduate destination. So primarily we're thinking about whether someone's employed or not, or going to further study, or and equally what their income might be, the sector they're working in, and so on. And those data sets are linked to the pediatric diabetes audit, which follows a person from diagnosis until they transition to adult services, and then they'll be in the adult services, which is held by a different data provider. So we're trying to pull all these data sets together and link them. So for that, we need common IDs. So in health data, typically we can just use NHS numbers to link things. But once we're thinking about education, then those things aren't there. And in fact, we're doing this linkage at the moment for England and Wales, and for Wales, we're able to use the NHS number for some of the linkages, but for England, we're having to do it with Department for Education. And so we're really having to work hard to get all the identifiers we need in place to link these data sets. In terms of the TREs and or the trusted research environment, we're using established repositories in England and Wales. And so in many respects, those problems are less important for us than from the other studies. And in fact, what we're really challenged with is the public engagement, and particularly getting the views of young people, and perhaps focusing on some of the more underrepresented groups, and making sure we get that support for what we're doing. Because again, like some of the other examples, we're using unconsented data, and so we do want to justify what we're doing, show the public benefits, show the safeguards we've got in place. So this is my last slide about the engagement work we're doing, which is the primary focus of the DARE work. And we want to ensure that this is meaningful, that it does represent a diverse group of people. And that's not just in the people we speak to, but also how we disseminate our materials. We want to think about wider uses of data. So there's a lot of technology in diabetes that provides new data, but that's often held by private companies, and there are challenges in accessing data. And then finally, we wanted to produce a toolkit so that other health conditions for young people, primarily those in the Health Conditions in School Alliance, could perhaps use some of these things. So I've talked a lot there, Charlotte. I'm sorry.
You stole my thunder. It's okay.
Sorry. Would you like to just follow on?
I just wanted to talk a little bit about the role of Diabetes UK, and actually how collaborating as a patient organisation and as a research institution is really positive and helpful in this kind of situation. We have done workshops in the past with young people with type 1 diabetes, specifically around Rob's research. And this is where we can bring the young people and the voices of those young people and their parents to the research as well. But also we chair the Health Conditions in Schools Alliance. So we have a real opportunity to bring the outputs of this research to the wider patient organisation community. The Health Conditions in Schools Alliance is made up of over 30 member organisations, including organisations like Young Epilepsy. So it's a way of I guess crossing the divides of conditions as well. But we're very happy to support this research project and getting the voices of young people with type 1 diabetes into it.
Great. Thank you very much, Rob. Thank you, Charlotte. Moving smoothly into the next, we have Professor Serena Examer from the University of Cambridge. And I hope I'm saying that right, Serena, your surname.
Yes,
Apologies.
it's all good. Thank you. I can't share my screen.
Sorry, it's mine.
Yeah. I think the other participant needs to come off. Needs to stop sharing.
Rob's working on it.
Sorry, it's just stopped.
All good.
That's fine. All good, Rob.
Thank you.
Okay.
Great. I hope you can see my slide.
I'm
Serena. So I'm Professor of Genomic Medicine and an NHS consultant in clinical genetics in Cambridge. So as a doctor, I deal with patients with severe, high-impact genetic disorders with real-life implications. But as a genomic scientist, I also understand the value in being able to work on anonymized and de-identified genomic and clinical information to develop algorithms for patient benefit. So I'd like to thank the DARE UK committee for supporting this proposal, which aims to establish federated infrastructure between Genomics England, the National Endeavour for Sequencing, and the University of Cambridge. So why have we put this proposal forward? Well, GEL's new Cloud OS environment houses over 130,000 whole genome sequences, and that's relevant to rare diseases, to cancer, to infectious diseases, and it's all de-identified. These are linked to national registries and an increasing number of clinical data points. So it's an extremely powerful resource. The Cambridge NIHR BRC Biomedical Research Campus is home to East Genomics. It's one of the 7 NHS genomic medicine services. It encompasses Cambridge, Leicester, Nottingham, and Norfolk and Norwich, and we research and support an ethnically diverse population of over 10 million people. Cambridge also houses many leading molecular biological scientists and computational teams, and you've heard from some of the others that many people often have little collections of data sets. These are little TREs sometimes, and they're powerful hubs of innovation, but they're rather siloed at present. And we recognize the importance of modernizing the infrastructure to enhance data sharing, both locally as well as nationally, to facilitate the translation of the research work into the NHS setting as fast as possible. Hence, Cambridge is building its own sort of bigger TRE with federation capabilities through a project called Synapse. Synapse is a multi-year, multi-phase TRE project, and the DARE UK application specifically supports the federation component with GEL. Now I'm going to share a scientific example that speaks to the power of having access to vast data sets in both GEL and Cambridge. So my team performed an experimental study, and we uncovered sort of novel mutational insights. And through the working partnership with GEL, we were able to immediately validate our findings, find these things in NHS patient data. But thanks to the availability of de-identified clinical data, we could go a step further. We could train, develop clinical algorithms, which could help guide treatment selection for cancer patients. So this one is called MMR Detect, and it made the news earlier last year, 2021. And in fact, Cambridge and GEL have partnered to file a patent on this algorithm. Now, while this was achieved, and by the way, it's going to be sort of placed back into the NHS bioinformatic pipeline so that it is available to cancer patients going forward. And while this was achieved, it was hard. So my team has lived experience of how to derive benefits from big data, but we also understand the barriers in detail. The bar for entry to data exploration is too high. It takes up too much time, demands too much IT expertise. It's also a litany of poor practice. So there's importing code, moving data, exporting results, exporting data. And every time you do one of these things, there is a risk associated. So there's huge value in having easily accessible and connected data sets that enable fast, safe, and efficient data sharing and analysis. So GEL and Cambridge CloudOS platforms have been or are being built by a UK SME called LifeBit. Both platforms have federation capabilities. LifeBit is thus a natural choice for enabling that connectivity between the GEL national endeavor and our university site. And given the sensitivities relating to data governance in joining up two sites, Synapse underwent a PPIE panel consultation in May 2021, seeking thoughts and concerns from the public. We had another one last week, in fact, February 2022. We've got further focus groups and workshops planned at every stage of the Synapse project. And there is patient-public involvement on the steering committee and data access review committees of Synapse. So that's governance. And in fact, we had patient-public representative Rosanna Fennessy as a partner on the DARE UK Federation application. And of course, GEL has an exemplary portfolio of how to make PPIE central to governance and clinical research activity. We have formal project management support from Eastern AHSN. They've got vast experience in health data research projects already. So our DARE application on federation comprises these 5 partners. So what do we aim to deliver at the end of the sprint? So these is 4 items, but if I try to put it into lay words, the reference architecture is basically what the link will look like. And the supporting open source APIs is how we're going to be building those links. The airlock design of data processes deals with many of the security aspects, and the use case is simply an example of an analysis that will be done across the 2 sites to show that we can make it work. And in terms of impact, our proposal, we think is directly aligned to the national desire that you heard at the start of this afternoon. And we'd like to design and deliver a novel, innovative, and joined up infrastructure, which we hope will be a first demonstration of a public sector thing with Genomics England and the university. We hope that we can produce a template that can enable replication and share this with other sites as well. And I think this really forces us to think through the different steps of how to deal with the privacy of the different data sets. And finally, we're really aiming to increase discoverability of data, because when we improve infrastructure, we improve access and equitability, and we increase the chances of being able to find new things for patient benefit. So thank you for listening, and happy to take any questions at the end. Thank you.
Thank you very much, Serena. So we have 3 more projects in this block. Next one up is Dr. Anna Moore from the University of Cambridge.
Hello, so hopefully you can see my slides. I'm just going to, there we go.
Yes.
Oh, brilliant. So I'm Anna Moore. Thank you very much again for inviting us to talk today. So our project is going to demonstrate how federated analytics of multi-agency data could be achieved across trusted research environments. And we're going to focus on the use case of early identification of childhood mental health problems. So although Cambridge is leading on the grant, we've benefited from a really rich range of collaborators who bring really critical expertise to the partnership. So lots of them are on the call today as well. So before I start, I just wanted to explain the term federated analytics. So it's an approach that lets us analyse data without us having to bring it all into one place. So we've heard a bit about this idea about data lakes and about the security risks that come alongside those. So instead of taking that approach, we're looking to build a technology that enables us to send the algorithms to the separate data sets. And that avoids the need to create these large pools of data, which can pose a security risk. So we're working with a company that is pioneering this method and combining it with strict security approaches. And that means that the data providers we work with are able to have strict control on who's able to access the data and when. And it means that we can link these siloed data sets while preserving the individual's privacy. And that's helping us to solve challenging issues like having enough data to train machine learning models in, and making sure that we can include data on a really wide range of individuals, and in particular those from underserved populations, which is a real challenge for some of the AI work that goes on. So in terms of how we're going to be using it for this use case, so our research has identified at least 196 risk factors which are associated with getting a mental health problem. We know they span 7 domains, and that includes social, environment, education, physical health, and behavioural issues. And we also know that over 60% of that data is in educational and social care records. So for example, information on childhood experiences or school attendance or how kids do at school. So this use case really demands that we're able to rapidly integrate and analyse data from across different environments. And we also know that building fair and equitable machine learning tools requires data that's representative of all of those individuals that we're aiming to serve. So we know that serious mental health problems, for example, things like schizophrenia and psychosis, very much more often affect those from underserved populations. And that means that these groups are really suffering worse outcomes, such as excess mortality and also social disadvantage. And so to try and address some of these problems, we really need to be able to analyse across data sets that are diverse, creating access to large representative samples, which are able to predict really rare outcomes. And at the moment, that's just not possible if we focus our energies within one geographical region. So to address this, we're going to demonstrate that we can rapidly integrate data from a broad range of settings, so health, education, social care, and that we can safely carry out this privacy preserving analysis across 3 TREs, so Cambridge and Peterborough, Birmingham and Essex. And we're going to answer the key initial research question, which is how common are mood disorders and adverse childhood experiences in children 0 to 17 years of age. So finally, and to make this a reality, we really need a governance solution that is legal, it's ethical, that's acceptable to patients and the public, but also to data providers. And that really needs to be grounded in extensive public and stakeholder engagement. So we've been working on this for 3 years now. And as a result of that, we've got the ethics and in place, and also the local permissions to be able to integrate and link the data and to start to develop these early identification tools. But what we really now need is to take this next step, which is to enable us to analyse across the 3 regions and to develop a governance model that enables that. So for the next 8 months, we're going to work together to try and find a solution for the governance as well, but one that's generally that's applicable to a range of different settings. And also can work with different TREs and also different disease areas. So a really key aspect of the project is developing this comprehensive governance approach, which enables us to manage that data well. And it's really important it's acceptable, it's viable, which means it works and it's possible. And it needs to be acceptable to the public, the patients, and also the other stakeholders, such as ethics committees and local IG leads. And also, of course, it obviously has to be legal. So we need this model to operate both within a region, also across different trusted research environments that are based in different parts of the country. So with experts, we're going to undertake extensive consultation to develop this framework and exploring both top-down approaches and also bottom-up approaches with the public, things like data trusts as an example. And we're also going to work across the 3 regions. to produce a model that works for all of them. So critically, it's going to involve really substantial public engagement. Now we're doing that in collaboration with Anna Freud Centre, also Kaleidoscope are working with us on this. And we're aiming to really build public trust and to achieve acceptability of what we're doing, for what we're doing. So at the moment, we've got an expert by experience group we've been working with for about 2 years now with Anna Freud, but we're expanding that currently to include coverage of in Birmingham and Essex, but also critically to make sure that we've got good representation from underserved populations. So we're working with this group to explore what the public understands is important about how data is managed, if this has changed at all since COVID, and then based on that learning, we're going to co-design a governance framework and develop education materials about the use of data. So you'll have seen, so our technical solution, I'm not going to go.
Just a little bit of a call on time.
Oh, so, okay. Essentially just saying I'm not going to go into detail about our technical solution, and very much the federation that I described before is described here, but critically it focuses on the 5 safes. And this is just my last slide now. So at the end of it, we're going to have this acceptable and generalizable model that can be used across all of the regions. But most importantly, we wanted to focus on why we thought it's important. Thank you very much. That's me done.
Thank you very much, Anna. Right, we're moving then to the next. It's Professor Emily Jefferson from the University of Dundee.
Hello everyone, hi. I am going to just share my screen. Can I just check that everyone can see that, no problems?
Yeah.
And you can see the one that's maximum, because I can't see that one at the moment.
See the one that's maximum, yes.
Yes, fab. Right, great. Okay, well, thank you very much for your time today to regroup for us to talk through our grey matter proposal, which I do personally think should have been awarded purely on the basis of the acronym. So this is our team of the most incredibly good-looking people you can ever imagine, from 5 different organisations. So we're an interdisciplinary group with expertise on trusted research environments, artificial intelligence, data governance, disclosure control, data security, and also confidentiality. And we have expertise in law and ethics, and 2 PPIE co-lay leaders for a particular work package, which are helping us bring this into the public knowledge, and also to seek input from lots of other people. So our topic is actually really quite a bit more specific than some of the other ones that we've heard about. And we're looking at a particular area of trusted research environments, and that's around artificial intelligence development within such environments. So artificial intelligence has many valuable uses, which are listed there. But training of AI typically requires access to extensive amounts of real-world confidential data, which we've heard about already is best provided within a trusted research environment. So our research shows that trusted research environments want to engage with AI and support AI development, but they don't know what to do in order to make sure that we're doing it in a safe way. So this is the basic model that we've already heard about, where you have data in a repository, it's given to people, to researchers, and you have this disclosure control checking process. And out of that, you might get a graph or a trend. And it's relatively easy for a member of the team who are running the trusted research environment to check that it doesn't have any potentially disclosive information. However, now for AI, we've got the same pseudonymized data, which is provided. It's used to train an AI model, which then needs to be exported. However, this typically includes very large arrays of numbers rather than a simple graph or trend. And it can be incredibly difficult for a trusted research environment member to manually check this information. So how can we make sure that we can enhance trusted research environments to enable AI, but still make sure that it is safe and secure? So there are a range of different risks which we've been analyzing, and you could have, let's say, a few examples are that you could have a malicious user which wants to hide row level identifiable data in the exported data arrays. But then also once you've got another type where a non-malicious user will unknowingly train an AI model, which then incorporates into the training data directly. And the other problem is that trained models always remember aspects of the training data. And so the exports can be susceptible to malicious attacks. So these are an entirely different group of people than train the algorithm. But once the algorithm's out in the wild, maybe used in a software product or something like that, it has the potential to be attacked. So our vision is to publish a green paper providing a set of guidelines and implementable recommendations for supporting trusted research environments to securely check AI exports for disclosure control. So what we're going to do is going to look at the theory and empirical evidence and look at the risk about that different models have. We're going to provide some step-by-step guidance for the trusted research environment staff. We're going to set a recommended set of tools, automated tools, so they can check the AI models. We're going to have a look at technical impact assessment. We're going to have a look at the legal side of this in terms of responsibilities and what we could do in terms of making sure that there are laws in place so that so that some behaviours are illegal. And we're going to also work on some lay summaries, public facing ones, and we're going to do community engagement, working with trusted research environments, researchers and the public. And we're going to do research and policy papers across this. So we've got three main phases of the project. Work package 1 is going to look at the risk across different AI models. Work package 2 is going to test the range of different tools. Work package 3 is around legal and ethical implications, and the PPIE group are work package 4. So we aim to have our very first draft of something after the end of 3 months, with several different review cycles across those different times. So in terms of PPIE involvement, we're going to be co-led by 2 different members. Or we are being co-led by 2 different members. We've got 4 workshops to put into our work with PPIE representatives, and we're still looking for some. So if anybody out there would like to be involved, please do let me know. We're working to understand what the public view is of disclosive information. We're developing lay descriptions of the stuff that we're doing, and we're also training our research team and myself on how to maximise working with the public. Thank you very much.
Great, thank you very much, Emily. Then moving into our final project for the day, James Fleming from the Francis Crick Institute.
Thanks very much. Let me just go full screen. Right, I'll try and be the guy who doesn't use up all the question and answer time at the end, so I'll be quite quick. I'm James Fleming. I'm Chief Information Officer of the Francis Crick Institute and represent a team comprising members from the Institute of Cancer Research, the Rosalind Franklin Institute, and BT Research and Innovation. We're a little bit unusual in that none of us is a scientist or an academic, but we are all the technologists that scientists and academics come to with their problems. So we work with and represent a community of 5,000 plus multidisciplinary researchers covering everything from frontline clinical research all the way through to much less clinical focused use cases, but engineering and a variety of other different areas. So what problem are we looking at? Well, fundamentally, our world is dominated by discovery research. And that is always, or almost always, about bringing data together. A good chunk of that may well be secure, sensitive, or patient identifiable, but a lot of it isn't. A lot of it is actually bringing together work which is being done in labs, perhaps with animal models, perhaps with stem cells, perhaps with who knows what, a huge variety of different methods. But the real value is when that data is brought together and aggregated across institution, working together with hospitals, with industrial partners, with a huge variety and network of individuals to derive new insights and new value. But the problem is, if it's got a secure component to it, the big question mark sits right there in the middle of who hosts it, what environment is provided to bring all of this data together and make sure that all the fail-safes are complied with. What happens in practice is that normally after lots of staring at each other for quite some considerable period of time, one institution within a target collaboration bites the bullet and decides to build a TRE. These are, as we've seen, there's many different flavors of what a good TRE looks like, but they all take considerable time, effort and expense to put together. And for many institutions or researchers, it's often simply not affordable or economic to involve that degree of time. So sometimes it happens, a lot of the time it never does. However, when it does happen, when you look at the entire picture in aggregate, you end up with potentially dozens of trusted research environments. And that's the kind of landscape a lot of our researchers try and navigate today. So wherever there's a partnership or a collaboration or a hospital or an institute, a new TRE springs up, which in turn means that as a researcher trying to find a way in to the data you want to access, the people you want to work with, the landscape is incredibly complex. And also coming at it from another dimension of how do you administer the 5 safes, how do you administer basic GDPR rights that you might, as a patient, that everybody has. Where is your data at any one time? Who is working on it? How do I grant or remove consent? These are incredibly complex questions and take out a significant amount of administrative time and overhead. And part of the reason that our team are particularly invested in it is a lot of that burden actually sits on IT departments within institutes and institutions around the place to try and find ways and means to solve this problem. We never want to be a barrier to research, but often practically we are because of the complexity involved. So what's our potential solution here? Well, we've been investigating a variety of different technologies out there on the market, and we're particularly intrigued by one called Snowflake, which is a multi-cloud data fabric, as it describes itself, which offers the opportunity for us to securely build in code trusted research environments on the public cloud that conform to best practice standards around the 5 safes, have every certification you could possibly need or require, but are quick enough and easy enough to configure and build that we can conceivably have a unique research environment for every single collaboration that we want to work with. So we envisage a process whereby you have a different data held locally by different institutions. Those scientists come together and agree the key questions they want to answer. As today, they will always go through a process of discussion and debate to really hone those down to the exact key questions and purposes they want to answer. Any application they do that involves patient data today is and will be scrutinized by the relevant research ethics committees, normally hosted by the individual hospital trusts in the mix. But where we come in is that we want to systematize that entire workflow and capture of all of that data, and then quite simply push a button and create a trusted research environment at the end of it that is uniquely specific to that particular research collaboration and question. Data can then be aggregated and loaded in there. It will only be available to those researchers and only for the duration of time that they actually want to run that project for. At the end of the project, we take all the data out, we archive what's left at the local home institution, so it doesn't leave the overall TRE ecosystem. We close it down and we move on to the next coordination, the next project. And we think this has got huge advantages in terms of speed, in terms of direct line of sight auditability between what's agreed up at an ethics committee level and what's actually implemented on the ground in terms of the 5 safes, and represents a very low barrier to entry for people wanting to do this kind of research. So finally, you can probably read that at your leisure. I know I'm short on time. We've got our goals to build a technology demonstrator, document our use cases, and also document the legal framework. We're building it in parallel alongside this. And our principles, as I've outlined, is we want to really open up data, but we don't want to do it in a compromised fashion. So we want to create a framework that is sustainable, that's speedy, but it's ultimately as good as or more secure than processes we have today. And finally, on the journey, we're involving 2 different patient groups, one a sort of group of cancer patients and one a group of neurological patients via our colleagues and contacts at the UCL School of Neurology. And we're at the moment still recruiting for a patient representation on our project board as well during the process. So if you're interested, do please email me to get involved. And with that, I'm going to draw that to a close. So we've got time for questions at the end. Thank you very much for your time.
Thank you very much, James. All right, thanks everybody for the presentation. So we sort of have 5 minutes left for Q&A, but I'm sure if you'd like to, we're happy to stay a little bit longer and go over. I might start with addressing sort of the first question which I saw came up in the chat, and this was from Max Wheel. I might direct this at you, Sushil. So the first question is, the speed of development during the pandemic has accelerated findings and solutions. One understands the need for privacy issues and the role of TREs, but isn't there a need to accelerate the availability of data to researchers to get treatments into the NHS environment at speed? Question one. And then the second part of the question, how does this fit with the NHS Digital's DARS, guest data access requests access approach?
Yeah, and I think that's an important question. I think it's also important to distinguish, the DARE program is not just healthcare, it spans all the UKRI councils. So yes, it's an important question. So I'll just direct you to some of the work that the UK Health Data Research Alliance has been doing around this. So streamlining the data access request process. COPI in itself, I would argue, has accelerated this. So I think there's an opportunity for us to look at COPI and understand what was accelerated and how can we use those learnings for future pandemics and accelerating the process in general. So yeah, so those would be the two answers to the question. But the UK Health Data Research Alliance has been doing some work around streamlining data access requests using 5-6 forms and also data use registers for increasing transparency.
Great, thanks, Sushil. So just looking through, I think we have from Tim Hubbard here, we have Snowflake. Last time I looked was a hosted service. The key when using a hosted service is who controls the encryption keys. AWS, which is Amazon Web Services, allows user total control of keys, so they can't access the data at all. Is this the same with Snowflake? I suppose that's to you, James.
Yeah, as I've dropped in, it's not hosted in that sense. So we, the admins, do retain control of encryption. So it's both at rest and transit. And for very secure stuff, they do offer a triple key encryption service as well. So there's an added layer of security we can add in should the use case merit it.
Right. Thanks, James. Then looking at James Robson's question, again to you, James. Have you looked into the work of Gaia X in the EU?
We haven't, but I certainly will be straight after this call. In fact, I've got it up on my browser at the moment. But yeah, thanks for the tip.
So for people on the call, Gaia X is the European Union's cloud procurement framework of trying to streamline some of the cloud procurement mechanisms. It's similar to our G-Cloud digital marketplace for cloud services, but that runs on a European scale.
Great. Thanks, Sushil. Then from Vasily, is there, again, apologies if I'm saying the name incorrectly, is there an issue being locked into a specific data cloud if the right form of compute resource is not available? For instance, very large memory systems for handling 3D data cubes. I'm not sure if there's any comment from any of the projects on that one.
I'll chip in on that one. I think the part of the reason we're using Snowflake, for example, is it actually sits across 3 clouds, so AWS, GCP, and Azure, so you can deploy any way you like. That's still not quite an answer to the question. And I suppose there will be circumstances whereby if you really want to have an absolutely boundary pushing use case, cloud simply isn't the right way to do it or the economic way to do it. In those circumstances, I think then you do probably need to look at a very different solution, something much more traditionally HPC focused to build your TRE. But certainly from our experience locally, the number of cases that actually really push those boundaries in life sciences are few and far between. So we're more focused on trying to find something that works for the majority of the time, just to get the edge cases down to a manageable number rather than it being a default. How do we work together every single time, which is where we are at the moment.
Thanks, James. I'm not sure, Vasily, if that sort of answered it. If there's any other comments from the projects.
Yeah, no, I think that sort of broadly answers it. I think I'm seeing some use cases come up from some of the European institutes now, but it is 3D volumetric work. And I've seen requests for sort of systems running at kind of tens of terabytes. And obviously you can't really do that in the cloud. That sort of technology doesn't exist. So that's really what I was thinking.
Yeah, I think Vasily, that it's an important part around hardware virtualization. It's quite hard to do it, especially at a cloud level. So things like bioinformatics core processors are all things that we see. When those use cases do appear, I think the cloud gives us a mechanism to be able to scale out into or burst out into those external clouds. But for that to work, I think we need to have standards. So some of the work that we're doing around the Sprint Exemplars is trying to explore that solution space to come up with the right standards so we can do federation and burst out into external clouds if necessary.
Great. Thanks, Sushil. Then looking at Sam's question, did anyone use anything other than AWS or Amazon Web Services? It's notable that ONS have picked Google Cloud instead and articulated their reasons. So again, open question to the projects there. James, seems you're on the spot.
I'll chime in on this one then. Just even outside of this, we use all three main public clouds of Crick. We find that actually having access to the right tool for the right job is most important. They've all got subtly different strengths and weaknesses, either in terms of provision of hardware or actually some of the services that sit on top of it. So we took a strategic decision a while back, given the heterogeneity of what we work on, we were going to build virtual data centers on all three. And you know, it's horses for courses depending on what you want to do at a given point in time. So even outside of this, I think, yes, there's good arguments for using some of the others in certain circumstances.
Thanks, James. Susie, do you want to chime in there?
I do, yeah, just from Fednet's point of view. So we've gone down the Azure route, because that's obviously what Pioneers built all our infrastructure on over the last 2 years. But actually Nottingham use a very different instance of Azure. So it'd be quite interesting for us to see 2 different Azure blueprints. But also the key bit for us is that, as we sort of said as part of our sort of interview and application, was that that's our starting point. But we do acknowledge and understand and have worked with Azure, AWS, Google. So we want to sort of test and expand that, but in the first instance, Azure, and then we'll be looking, and as James said, there'll be strengths and weaknesses around some of those.
Great, thank you, Susie. Michael?
Yeah, just down in Southampton in Wessex, we're engaged with Azure, although we've had spoke to Google and others as also. I think it's worth noting that Microsoft have an open source Azure TRE project, which is being co-developed across a number of different engagements in the country. Obviously, they're building open source software to drive traffic into their data centers, but the fact that it is open source is very interesting.
Yeah, and just want to add very quickly that multi-cloud is kind of a myth at the moment. You will never get to full multi-cloud sort of implementations, especially for federation. You will have multiple clouds. And again, as James said, you're going to pick the right solution for the purpose and the research project that you need. The baseline work is where some of the things that we could do around there. The baseline set of storage compute services is where we could standardize and help the cloud providers to also allow people to quickly switch between the various different providers. So from a data perspective, it's much more around standards and interoperability that we're trying to focus on across both public cloud providers, but also hybrid cloud environments as well, because a lot of the data has a huge amount of gravity that we stored in on-prem environments as well.
Yeah. Great. Thanks, Michael. Thanks, Ashil. Just having a look if there's any other questions. I hope that addressed the question, Sam. I don't see, I mean, I see the comment in the chat from Blaise Thompson. Okay, that's fine. I don't see any other questions. I'll sort of leave it for another minute or so to just ponder any questions. While everybody's pondering, I just want to say thank you all very much for your time, particularly the Sprint projects for coming to, to present to all of us here, but also to members of the public who've joined and members of the research community as well. We appreciate that you've joined us today for this extended lunch, I suppose. I suppose we're all going to go and eat lunch now. So if there are no more questions, I don't see any popping up. Please, of course, feel free to, via the Dare UK website, dareuk.org.uk. You can look at a lot of the details around all the Sprint projects. And of course, if you want to get in touch with the team, you'll find the details of how to contact us there as well. So if that's it, which I believe it is, thank you all very much. Have a fantastic rest of your Wednesday and a fantastic rest of the week. Sorry, it's a Tuesday. Have a fantastic rest of your Tuesday and a fantastic rest of the week. Thank you all. Cheers. Bye.